Cardiac Rehabilitation, your road to recovery. Cardiac rehabilitation is a way of helping people live heart-healthy lives following diagnosis with a heart condition.
So after I came to face the reality that I had a heart attack, the first thing was, how do I get better?
Through education and exercise, people can learn to reduce their personal risk factors of heart disease. Heart disease can't be cured, but it can be controlled. You can live well with a chronic condition, and the journey to improving your health often begins with daily choices, a small step that becomes new patterns of living.
Often patients leave the hospital after they have a heart event, and there's a mix of emotions. On one hand, they're relieved to be going home, and on the other hand, there's uncertainty and fear about the road to come. By making some important lifestyle changes, you can help decrease the chance of another heart event. One way to help you do this is by joining a cardiac rehabilitation program. This DVD will help explain to you how cardiac rehab can help you in your personal road to recovery.
In Canada, someone dies from heart disease or stroke every 7 minutes. Cardiovascular disease takes more lives than all cancers combined. It affects people of all ages and backgrounds. Even though it is so common, it can be treated and it can be prevented.
Hi, my name is Cindy, and I've been dealing with heart disease for the past 10 years. I had a heart attack when I was just 43 years old, and I had bypass surgery 3 years ago at the age of 50.
While medical procedures saved many lives, more has to be done to prevent heart disease and its reoccurrence.
First of all, I was in denial about why I had a heart attack. I couldn't understand why it would be me. I'm fairly young, very healthy, fairly active. I ate a pretty good diet, maybe too much food, but I ate a pretty good diet. Always was calorie and fat conscious when eating, but I still had a heart attack.
Too often, people live in denial about what has happened. They do not want to change harmful life habits that put them at risk of developing heart disease.
Now I know that it's not something that's going to go away unless I'm really careful with diet, exercise, and changing my lifestyles to some extent. So it was a very, very good experience to go to the first class.
Research has shown lifestyle changes and regular exercise improves physical and emotional health. These are the main goals of cardiac rehab programs. Anyone who has been in hospital with a heart condition may attend cardiac rehab classes. Family members or support persons are also welcome. Classes in the Regina Qu'Appelle health region are held 11 months of the year at various sites in the city.
A lot of other things that helped me along my way were certainly the health classes through the health region. I attended every one of those with my wife, and we picked up bits and pieces at each of the classes that we've used over the last while.
There is no cost to attend other than transportation and parking. A team of health experts presents on various topics related to heart health. Here's an overview of what is covered in the Regina classes. Understanding heart disease. At this class, you will learn how the heart works, signs and symptoms of heart problems, as well as treatment and management of common heart conditions. Risk factors. In this class, you will learn to identify your own risk factors, as well as ways they can be managed.
And as we talk about them, we're going to start talking about what you can do for yourself, the strategies to improve your own personal heart health. In particular, we're going to concentrate on 3 specific risk factors today: managing cholesterol, managing high blood pressure, and the need for smoking cessation. So this is where the rubber meets the road. This is where the class starts to get practical.
Diet and nutrition. What we eat affects our heart health. This practical class covers how to read food labels, choose foods low in fat and salt, and reduce portion sizes. These skills will boost confidence as you look after your nutritional needs and those of your family while making heart-healthy choices.
I was just amazed how people had changed their lives and how they had taken on a completely different way of eating and way of looking at things. And I think the most informative thing was for me the education of reading labels. It was so so important. And then the week after that, they had a dietitian at the ordinary classes, and she went over it again. And that, to me, that's a lifesaver right there. Absolutely.
Medications.
I'm Bill Semchuk. I'm a pharmacist here in the health region, and I work extensively in heart disease. Within the hospital setting, medication use is highly regulated, prescribed by physicians, dispensed by pharmacists, and administered by nurses. Once you go home, the way you use your medication is up to you. As a pharmacist, I believe there are 3 rules that you have to understand about the use of your medication. What your medication is and what it's being used for, what to expect from it, both good and bad, and how to take it and for how long to take it. To give you an example of how we can apply those 3 rules to a medication that you may be prescribed, let's look at clopidogrel or Plavix. This medication is an antiplatelet agent, and it's used to help keep the blood flowing through your blood vessels and prevent them from closing down. The benefit is profound, generally decreasing risk of a further event, vessel closure or complication by more than 50%. The risk is small, about a 1% increase in bleeding, which can be generally dealt with. This medication is generally restricted to 1 year of use. However, in certain situations, as dictated by your physician, it may be used for a longer period of time.
Stress management. Stress is a real part of life, whether in day-to-day routine or during times of crisis. How you manage it affects your health, your relationships, and your quality of life. This class will help you learn effective ways to manage and reduce stress on a daily basis. Exercise and activity. Exercise is much different than simply being busy throughout the day. It helps to strengthen the heart muscle. It is also good therapy for mental and emotional well-being. You'll learn the basic principles of a heart-healthy exercise program and ways you can become more active. All education classes are interactive. One benefit of being in a group is being able to share with others who have had similar experiences. Knowing you are not alone can be an important part of the healing journey. Many cardiac rehab referrals come direct from the doctor's orders. If you are from the Regina health area, the coordinator will either visit you in hospital or send you a letter of invitation to your home. If you would like to attend Regina classes, please phone 766-3843 to register. Education classes are offered in many health regions throughout the province. The Regina coordinator sends referrals to the local coordinators who then contact you. An important part of looking after your health is learning to seek out resources. There are several ways to find out what is available in your home area. Bulletin boards on heart wards at Regina hospitals have information from many areas. You may contact Heart and Stroke at 1-888-473-4636. You may also speak to your nurse before leaving hospital or talk to your family doctor about what is available in your local area. Telehealth may be another option for education. Video technology allows people to watch Regina sessions at a center close to their home. This reduces traveling long distances. You can contact your health region to see if the service is available near you. After a heart event, most people can begin to exercise in a moderate way. The important thing is to find an enjoyable activity so you'll be motivated to continue. Exercise that has the greatest health benefit is done over the long term, not just for a few weeks or months. Always check with your doctor before beginning an exercise program. You may want to exercise on your own or with a friend, or perhaps join a fitness program. In Regina, medically supervised exercise is offered at the Dr. Paul Schwann Center. There is a fee to attend, and your doctor must refer you to the program. Contact your local health region for information on similar programs in your area.
I had to go down to part-time, and I come here part-time, so actually this is my job. I see it as my job. I have to stay healthy, not only for myself, but for my family.
An important part of your road to recovery is learning how to live a heart-healthy lifestyle. This can be challenging, but not impossible.
So it's so important that if you have any symptoms that you don't shrug them off and think that because you had tests earlier that everything is okay. You need to follow up and be an advocate for yourself to make sure that you aren't having a heart attack or having heart problems.
Cardiac rehab classes guide you toward making good personal choices. Make a decision today to join a cardiac rehab program near you. It can be a matter of health and well-being.
With your chrome heart shining in the sun, long may you run. Long may you run. Long may you run. Although these changes have come, with your chrome heart shining in the sun, long may